Good to be with everyone. And we're going to really simplify the discussion to talk about one mineral, magnesium. I think this is a particularly fun topic because I've said it many times that magnesium is by far the most common nutritional deficiency that we see across all of mental health challenges. And if you're new to integrative functional medicine, magnesium would be the supplement you want to understand, to learn, and how to use. And we're going to start that process today. So, our current model in psychiatry is symptomatic based care, right? If you have a list of symptoms under depression, you're sad, you're not sleeping, you're feeling hopeless, you get a pill, an anti sad medication. If you're anxious, you get an anti anxiety medicine. There is no concept of underlying etiology. There's no concept of objective testing in our traditional model. And the reason why I do what I do, and I'm sure why some of you are here, is that we know we can do better and through a functional medicine lens. And here we talk about functional medicine. We look at many aspects, genetics and environment, but the number one most overlooked contributing factor is nutrition, or better described as malnutrition. So we've known malnutrition affects mental illness for many, many years. If we go back to the early 1900s, vitamin B3 deficiency, pellagra, it was rampant in the South, in the US, mostly the poor. And if you had pellagra, if you had a B3 deficiency based on dietary intake of mostly corn products, you became anxious and then delusional. You looked like what we call schizophrenia. 1/3 of all of our psychiatric hospitals were filled with people with a vitamin B3 deficiency. Nutrition, malnutrition, vitamin deficiencies affect the brain, causes, contributes to mental illness. And so when I teach my colleagues in psychiatry, I share a couple powerful thoughts about how we do that. And we've known this information for many years. I don't know if there's any Malcolm Gladwell fans out there, but he did, I think, 2 episodes on the Minnesota starvation experiment. Here, we took conscientious objectors, people that didn't want to fight in World War II. They were on a restricted diet, so they lost some up to 25% of their body weight. And just the weight loss, again, you had to be psychologically and physically healthy to get in the study. Just the restricting of micronutrients, vitamins, and minerals, they developed psychiatric symptoms, anxiety, depression, OCD. One gentleman in this study cut off a finger. He was delusional. He said, I heard a voice just by malnutrition. So, nutrition affects behavior, nutrition affects psychiatric illness. My colleagues, their anatomy lesson is pretty simple. We have a neck, right? What happens in the body affects the brain, and we have to train our mental health clinicians to check what's happened on the body. And when we talk about micronutrients like magnesium, they participate in hundreds of enzymes, and they work as cofactors or precursors. The amino acids act as precursors to neurotransmitters. The vitamins act as cofactors. And here you see how vitamin D and folate in this enzyme works as cofactors to make serotonin. And we're going to focus on magnesium as a cofactor. And just the basics is understanding how these micronutrient cofactors influence brain function. It might be pretty obvious. It's simple biochemistry, but it's just not integrated into our clinical practice. And that's what we're going to discuss with magnesium. So a little background. It is a common deficiency, 75% of all Americans. But we're going to talk a little bit about ADHD because it's such a powerful example. But some of the research, 95% of kids are magnesium deficient. I have seen adults, children, and adolescents with ADHD, and I would say 100% are magnesium deficient. I believe there's likely a genetic influence as well. But it's a common deficiency for lots of reasons, dietary intake, our farming practices, and we'll get to a few other reasons. It is present in every cell and every organism on Earth. It's kind of important. The energy currency of every cell, ATP, is actually magnesium bound. So ATP is often actually with magnesium. So the core energy currency of the human body requires magnesium. Our stress response requires magnesium. And here we see one of the many reasons people are deficient, because as cortisol levels go up, hence when we're under stress, magnesium goes down, right? We just deplete magnesium. So long-standing chronic stress, magnesium is depleted from the body, and a whole host of our kind of stress response symptoms are related to magnesium deficiency. So the stress response, and then for neurotransmitter synthesis, if you see magnesium is critical for a serotonin synthesis, and we know that to make melatonin, our sleep hormone, you need serotonin. So also critical to support sleep. So why is magnesium so commonly deficient? Again, we have genetic variations for all these micronutrients in terms of our needs. But these are some of the examples. I mentioned stress, and I'll keep coming back to that as I believe one of the most common. And good stress, bad stress, as cortisol level goes up, magnesium gets depleted. But I mentioned ADHD and medication, certainly our stimulants that we use for ADHD, they all cause a depletion of magnesium. So many of these side effects to stimulants, the anxiety, the irritability, the hair pulling, the insomnia, all can be traced back to magnesium deficiency. Alcohol, caffeine, and then soft drinks is really important. It's not just the sugar in soft drinks, it's actually the phosphoric acid. So any of the drinks, whether they're healthy drinks or diet drinks or sugar-laden soft drinks, they all contain phosphoric acid. And phosphate binds magnesium, and they both are excreted. So whether you're sitting there drinking diet Cokes all day long or regular sodas, guess what? Phosphoric acid in any of these soft drinks bind magnesium, making it unavailable. And for many of our patients, think of our ADHD patient who's under stress. Our adults might be drinking a lot of caffeine, stimulants, and lots of soft drinks. Chronic magnesium deficiency. So we learned early on in my training, if it's spasms, think magnesium. Okay, so any kind of disorder related to muscle spasms, and it could be muscle twitches, eye twitches, leg twitches, or some of our smooth muscle from asthma to migraines to irritable bowel to interstitial cystitis. It's all related to magnesium deficiency. Heart rhythms. So abnormal heart rhythms we often find related to magnesium, and insomnia and constipation we'll get to, but lots of physical symptoms. And we'll go through why physical symptoms are really important, because we don't have good testing. I'll repeat, we don't have great testing for looking at magnesium deficiency. But the research has been pretty clear. Whenever we talk about nutritional medicine, there's not great research, but we have research looking at magnesium deficiency associated with depression, anxiety, ADHD, insomnia. So let's talk a little bit about some of these studies. This is always fun because it's 2024. I was going to say this year, but I missed it. So within the past year, a meta-analysis looking at 75 studies, looking at minerals, and guess what? Low levels of magnesium and zinc are lower in depressed individuals. Very comprehensive study. Another recent study, again, meta-analysis, putting studies together, not a lot of patients, 325, but adding magnesium, unrelated to testing, was associated with improvement in depression. And here's anxiety and sleep. So 60 adults. And this was important because it was after kind of open heart surgery, lots of stress, lots of insomnia, lots of anxiety. And those that got magnesium had less stress and better sleep. So here's the challenge. If 99% of the magnesium is in your tissues, and that could be your bones, your muscles, or intracellular, then it's very challenging to look at a test, a blood test. A serum magnesium is kind of meaningless unless you're ending up in an ICU. Some people look at RBC magnesiums. Those are better, but I can tell you many normal RBC magnesiums, we still find magnesium deficiency. So that is the challenge. So that's why we'll come back to clinical symptoms, understanding the clinical symptoms of magnesium deficiency. And I do look at RBC magnesium as a marker, but I also look at trace mineral hair test. So I've been looking at this test for 30 years. The first 15 years, I never talked about it in public with my colleagues. But now it's really important that we understand that trace mineral hair testing is valuable, not for every one of these micronutrients that are listed here. Like we wouldn't look at iron through a hair test, but I have found magnesium to be very helpful. If magnesium is low in the hair test, it is pretty significant. We also use the hair test to look at elevations of copper, undetectable lithium, and oftentimes low zinc. But certainly the calcium magnesium can be helpful. We often see low levels of magnesium in the hair. Blood test was fine. RBC magnesium was normal, but very low levels of trace mineral hair testing. Trace mineral hair testing looks at averages over 3 months that's excreted into the hair. But this is what I need you to remember. These are the four most common symptoms, indicators of magnesium deficiency. You'll see it in your depressed patients, your anxious patients, and your ADHD patients, muscle cramps or spasms, insomnia, constipation, and anxiety. These scream out magnesium deficiency. Many of these will go away with a few weeks of magnesium supplementation. Constipation, insomnia, sleep improves, muscle spasms improve. Depending on the underlying anxiety, depression, or ADHD, there might be other kind of micronutrients we need to support, but we do pretty well, pretty quickly with sleep, constipation, and muscle spasms. Okay, so think clinical, and then you can add the asthma, the migraines, the irritable bowel, oftentimes due to magnesium deficiency. So I've been using magnesium glycinate for 30 years, and I still do. Each pill is usually 120 milligrams, starting off 120 twice a day, and then often we need to increase to twice a day, 240, two pills twice a day. It's around 500 milligrams. To replete magnesium, often it takes that much. Taking one at night might help some people sleep, but really not significant. There are many other forms of magnesium. We try, I stick with glycinate, there's citrate, there's sulfate, magnesium threonate gets a lot of press because people believe that across the blood-brain barrier better. I haven't seen that many people that do better on threonate. It's expensive, and occasionally somebody might. But glycinate has been the easiest. And what we try not to use is magnesium oxide, unless you're constipated. So magnesium oxide is great for constipation, but only 10, 20% is absorbed. So it's not great to replete magnesium. Now, there are early studies that were done just using magnesium oxide with improvement in mood. I think one was an ADHD study. So you'd still absorb magnesium oxide. I mean, it costs pennies, but it is used more as a laxative. Okay, side effects. The only real side effects we think about would be low blood pressure, which I've seen once in 30 years, and loose stools, which you see more often. But loose stools with magnesium supplementation does not mean somebody has adequate magnesium. So you try to switch formulations, the chelate, you reduce the dose, you take it with food, but usually you can find a magnesium supplement where they're not, having loose stools. There are other forms of magnesium. There's liquid and creams. In the old days when I used to use the topical, I have a few kids who got burned. They noticed a burning sensation. It's not common, but it happened. And you never like a kid yelling at you if you're a clinician. And then there's the magnesium sulfate or the Epsom salt baths. So a nice treatment, particularly for kids, trouble sleeping. You can just do a foot bath in the evening with magnesium sulfate. So we have liquid, we have pills, capsules, we have creams, we have oils, and we have sulfate baths. There are many paths to replete magnesium. Again, most common deficiency that we see in psychiatry. It affects stress. It affects hundreds of other enzymes in the body. And the research is decent on improving mood, anxiety, and we're going to focus a little bit on ADHD. So when someone presents in the office and they present with any number of these symptoms, ADHD, anxiety, depression, sleep disturbances, I have no problem recommending magnesium on the first visit, regardless of testing. Most of my career as a functional psychiatrist, I'm looking at testing to determine that path, that personalized treatment path, and everyone's going to be different. But I typically would say magnesium glycinate, how often to take it, and try to wait till after you do the blood tests that we're ordering. So that might take a few days before you start the magnesium. But at least I want them to start it before we waiting for the testing, which could be, 3, 4, 5 weeks. Okay, I want to kind of focus a little bit on ADHD. We got lots of different kinds of ADHD, our inattentive kids and our impulsive, aggressive, hyperactive kids, both diagnosed ADHD, both stemming from a genetic vulnerability. These are not behavior problems. These are neurobiological problems, right? And the treatment is pretty much take medicine, right? The diagnosis could be a $10,000 neuropsych eval, or it could be a 10-minute visit in a doctor's office, or it could be a computerized checklist. There are problems with all the above, but because it is a clinical diagnosis, either way, the treatment is medication. And we're talking about stimulants, we're talking about amphetamines, and the medicines are only good when you take them. So it's not like they work 24 hours. These are short-acting medications. When you're taking it, 80, 90% of people get better. As soon as they stop the medicine, all the symptoms of ADHD come back. But there's a large subset of individuals, adults, and children that have side effects. The most significant is appetite disturbance, the most common. But we see headaches, we see tics, we see dry mouth, irritability, anxiety, hair loss, digestive issues, and more sleep problems and more appetite problems. Sometimes these kids lose significant amount of weight. Sometimes these kids have resulted in an eating disorder. So we have a tool that works, and as a functional psychiatrist, I haven't thrown away my prescription pad. I have no problem supporting somebody struggling with ADHD because it has nothing to do with intelligence or ability to achieve. It has to do with sustained attention. But I also look for other modalities of treatment, and that's where magnesium comes in. Because if we don't treat this illness, if we don't treat ADHD or parents that are talking about just more discipline. You got to be tougher with these kids. This illness results in just significant assaults on one's self-esteem. Think about it. You're criticized at home for being late, for not getting stuff done. You're criticized in school. You're criticized with your peers, and then back at home. It is a horrific assault on one's self-esteem due to a biological disability, this inability to inhibit behavior or to focus. But besides self-esteem, the effect in eating disorders, high rates of binge eating, bulimia, and even anorexia, particularly in girls, impairments in relationship, school, family life, and certainly careers. If you think you're dumb, stupid, and lazy, you're not going to be thinking of grad school. So the point here is this disorder has to be treated, whether it's with medicines or in a functional approach with nutrients like magnesium, but you have to be able to help these kids. When we talk about driving, there's much, much higher incidence of driving accidents with ADHD. There's one pharmaceutical company that's building their whole advertising campaign. It's a drug company for ADHD meds, stimulants primarily. They're building their whole marketing campaign around driving and accidents. So the research is quite extensive. And then in adults, you have higher rates of divorce, higher rates of money problems, and occupational. So this disorder does not go away with kids. Many just continue to have symptoms into adulthood. And as we talked about, it's just based on this symptomatic checklist with no testing. And in functional psychiatry, we focus on the underlying tests. And in the book that I wrote, the plus minus plan, we talk about all the tests and everything that we discuss in functional psychiatry and all these courses. We talk about this concept of biochemical individuality. Everybody is unique. So here's a little bit about what this plus minus plan is, right? So you have an ADHD kid that might be very high in copper and hence low in zinc. And some kids will need B vitamins, some kids lithium, and then we have to talk about the lead and the dyes. And again, this is an extensive course we can go over, but I bring it up here because magnesium is the one supplement that, in my experience, has to be added to every patient with ADHD. That's why I've been doing this for many years, thousands of adults, of kids, inpatient, outpatient, and I have not found an individual that hasn't benefited from magnesium. That's why I'm quite convinced there's some genetic difference either for higher needs for magnesium or it's just kind of the chronic stress. But when you think of ADHD, you need to think of supplementing with magnesium. So here was one study, again, a meta-analysis, lower serum levels of ADHD for magnesium. There's another putting 12 studies together, ADHD versus not ADHD kids, and significant difference between magnesium. And again, these are serum and hair, where I told you the serum levels aren't very accurate to diagnose a deficiency, but you certainly can compare the lower kids. And then these are older studies where they actually gave magnesium, and it's pretty dramatic. And this is the kind of thing you'll see in a practice: less hyperactivity, less oppositional behavior, better executive function, and improved attention. So I'll just use this slide to repeat again. ADHD is not a discipline problem. It's not a behavior problem. You can punish these kids. I've had parents who've taken away, things from their room repeatedly, so they just end up having a bed on their, and everything else is taken out. And guess what? The behavior is not improved because this is not willful. It's not oppositional. It looks that way. But what it is, an inability to control impulses, an inability for sustain a persistence of effort on tasks, and that's biochemical. That's neurobiology. And magnesium deficiency is just a huge part of that. More studies. I shared with you magnesium, that the medications we use for ADHD, the amphetamines, causes depletion of magnesium. Think about some of the side effects. You have anxiety, you have picking, you have chewing, you have anxiety. These all can be eliminated if you start magnesium when you start the stimulant. Even tics. I can't tell you how many kids we've seen that develop tics on stimulants, the eye twitches, the eye blanks, the mouth movements, and these can disappear with magnesium. Now, not all the tics, some kids have Tourette's and significant tic disorder. Magnesium is part of the treatment, but they don't disappear. But for those that never had tics, put on a stimulant, develop a tic, those often will go away with magnesium. Okay, sleep problems. Again, one of the most important roles of magnesium clinically is improvement with sleep. The first study was magnesium 3 and 8, and here 500 milligrams a day, just improvement in sleep and stress. So when we look at a functional medicine approach for ADHD, it is not a one supplement prescription. It is looking at a functional medicine approach. And these are not all, but some of the things that we want to understand. Lithium, we use low dose lithium. We use probiotics for gut. We improve sleep. We look at amino acids and vitamins and other minerals and essential fatty acids. But the focus of this presentation is magnesium is one of the most important and is deficient in the vast majority of children and adults that we see. Okay, here's the book, the plus minus plan. But again, I would add magnesium to everybody I see that has ADHD, but the whole focus might be on dysbiosis. And we might be overgrowth of yeast or Clostridia, but magnesium is always added. And if we start with magnesium, and my second choice would be fish oil, and then as we start doing the functional testing, we can really kind of fine tune this treatment so we're not guessing. Too much of psychiatry is just educated guesses, right? And this term, let's try this medication, doesn't instill a lot of hope in our patients versus you have a deficiency in B12. We are going to replete that deficiency. That's a little more focused and provides hope, for our patients. So I'm sure many of you are aware, but this is not alternative medicine when we talk about adding magnesium to depression, anxiety, and ADHD. We're talking about just improving treatment and improving healthcare. So these are my websites, Psychiatry Defined and James Greenblatt's, where we have our books. And we're signing up for our fellowship that starts in another week. So if you're interested in a year-long training program, please book a call and we're happy to talk with you further. And I guess I stuck this in. You can't use the word alternative medicine. We're talking about nutrition as fundamental to human biology, to brain function, and understanding the role of nutrition is really critical.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.